Namaste, and Siddhi Pranam. Welcome to your today's topic, which is pregnancy and mental health. So let's dive into understanding the correlation between pregnancy and mental health and the relevance of mental health during pregnancy. So ideally, pregnancy should be enriched with positive emotions and feelings. However, in reality, the shades can become very gray, and pregnancy entails various psychological, physiological, and hormonal changes that makes mothers more susceptible to mental health issues. So it has been reported that nearly 25% of the pregnant women experience mental health problems during pregnancy or within the first year after delivery, which is the perinatal phase. So the prevalence of poor mental health is really higher in developing countries than in developed ones. So mental health problems during motherhood have a very profound impact on the well-being of the mother, infant, father, and the family. So if left unaddressed, these acute periods of mental health problems can escalate to chronic conditions. And unfortunately, these problems often go unnoticed or are concealed owing to inadequate diagnosis or societal stigma. So when we look at the effects of the mental health, the pregnancy causes really drastic changes in the mother's hormonal levels, and that leads to a cascade of physiological as well as psychological issues. So poor mental health during pregnancy can lead to preterm labor and low birth weight. Moreover, it can lead to development disorder in early stages of the fetus and also in the later life of the baby. Also, mental health issue during pregnancy can lead to unhealthy behaviors such as smoking, alcohol intake, or substance abuse, or which are very detrimental to both the health of the mother and the baby. So, due to the early identification of postpartum depression, PPD, initially the primary focus was on the mental health of the mothers. However, advancement in research have also revealed that mothers are also vulnerable to depression, anxiety, and other mental health issues during pregnancy. So, it has been really discovered that mental health of mother during pregnancy can significantly impact the overall development of the baby even in the later life. So as a result, the mental health of the mother is given proper attention from conception until postpartum nowadays, specifically in the developed countries. So let's look at the risk factor. So the major risk factor for mental health problems during pregnancy are primarily associated with social and psychological factor rather than physical factor. So cultural practices, stress, history of depression, or lack of social support, unintended pregnancy, and difficulties in communication are quite significantly contributing factors that affects the mental health during and after the pregnancy for a woman. And additionally, poor marital quality, lack of intimacy between the couple, and sometimes unintended pregnancy and also domestic violence influence the mother's mental well-being. And the quality of the relationship between the partner also affects the bond between the mother and the fetus. So support and acceptance of pregnancy from the husband or the partner plays a very crucial role in ensuring positive mental health during pregnancy. Similarly, financial independence and education also contributes to the well-being during pregnancy. And improved financial conditions and education offers a very greater access to healthcare services and enhanced social interaction for the mother. And these factors are positively associated with better mental health outcomes even among the mothers in lower income countries. So in summary, I would say that the socio-economic status, support system, and other resources, as well as the marital quality, significantly influences the mental health of the mother during pregnancy. So let's look at the types of mental health issues. So the mental health problems in pregnancy may arise may show up in a very different manners. So first it can be bipolar disorder, which are frequent episodes of depression and mania. Now, post-traumatic stress disorder, PTSD, is also one of the mental issues that shows up during pregnancy. Panic attacks, which is are also one of the seen common, mental health issues during pregnancy. OCD, which is obsessive compulsive disorder, is another known diagnosis. Now, eating disorder, sometimes overeating or less eating, is also seen as a mental health issue among pregnant women. Anxiety and as well as postpartum depression, PPD, are most widely reported psychiatric issues during the pregnancy and also after the pregnancy. So let's look into depression primarily. So depression is defined as a feeling of sad and feeling down or irritable for a longer period of time. And it is characterized by low confidence, feeling unworthy, easily irritable, fatigue, poor appetite, or lack of concentration. So women with a history of depression are more vulnerable during and after pregnancy and express self-harm as well as suicidal tendencies. An unnecessary glorification of pregnancy can build undue pressure on mothers to look perfect and happy. Hence, sometimes they start feeling guilty about experiencing negative emotion during pregnancy, and hence most often it is undiagnosed because women tend to hide this due to social pressure. Now, postpartum depression. This is most common subtype of depression among females, and it is experienced by the mother after the delivery and can last up to 12 months. And its prevalence is higher in low-income countries. History of traumatic experiences such as stillbirth, abortion, lack of social support increases the risk of postpartum depression. And females who have experienced previous depressive disorder or sexual abuse are more prone to postpartum depression. Similarly, other silent risk factors include domestic violence, stressful life events, and also marital disharmony. Moreover, sometimes poor socioeconomic status like poverty, having more than required children, and also lack of education for the parents or the mother can also negatively affect the mental health status of the mother. So postpartum depression among mothers leads to difficult temperament in infant or the baby also. And it is characterized by clinging behavior, irritability in the baby, and frequent crying by the baby. And similarly, recent studies have observed that maternal depression may lead to poor cognitive as well as language as well as emotional and behavioral development in the baby. And these development disorders are also evident in mothers who experience stressful events during pregnancy. So postpartum depression affects the relationship between mother and their children, and it can affect a child's psychological, emotional, as well as social well-being later in life also. So symptoms of postpartum depression can also persist even up to 2 years after delivery. So nurturing the newborn is a very demanding process that requires considerable attention and dedication by the mother. Hence, partner support is very, very crucial during this time period and can help address postpartum depression. One of the major factors that helps to protect mothers from PPD is breastfeeding. It also enhances the relationship between mother and the baby, but also ensures the well-being and of both the mom and the baby, and improves the self-esteem of the mother. So postpartum depression and breastfeeding are closely associated. Postpartum depression can lead to early cessations of breastfeeding. However, breastfeeding can reduce the PPD intensity. So, immediate skin-to-skin contact after delivery for 20 to 120 minutes and early sucking have a very positive influence on the mother-infant attachment. There is a term called maternal fetal attachment, known as in short MFA, and which is influenced by the maternal health of the mental health of the mother. Now, coming on to anxiety. So, anxiety is excessive worry or fear about a thing or thing in the future. And similar to postpartum depression, antenatal depression is also widely present among pregnant women. So various types of anxiety disorder can include panic disorder, obsessive compulsive disorder, OCD, or generalized anxiety, as well as perinatal anxiety symptoms. So in the anxiety symptoms can include, panic attacks, hyperventilation, reoccurring of frightening thoughts, excessive worry, or poor sleep. And chronic anxiety during pregnancy may cause persistent attention difficulties in babies later on in life. So psychological distress during the antenatal period negatively affects the obstetric and neonatal outcomes. So poor mental health during the antenatal period also increases the risk of postnatal and later mental health problems for the women. And mental health issues during the antenatal period also varies across trimesters. So antenatal depression is more prevalent at 12 to 16 weeks than during the third trimester of pregnancy. And antenatal depression increases the risk of lower birth weight, also preterm birth, and delayed prenatal growth. And these risks increase with the depression severity during the antenatal period. So antenatal distress can persist throughout the pregnancy and during the postnatal period also. And there have been studies that have shown a very positive association between antenatal distress as well as birth outcome. So, however, if the birth outcome is positive, then the distress goes down and the mother can feel better. And it's vice versa. If the birth outcome is traumatic or in any manner, then the distress goes quite higher in the mothers. And additionally, both antenatal as well as postnatal distress can affect important aspects like mother-fetal attachment, temperament, as well as child's or baby's cognitive as well as emotional and behavioral development. And the effects of mother's mental health extend beyond infancy and can have enduring implications for the behavior of the child in the adolescent ages as well. So the primary reason for psychological distress is constant hormonal flux during the pregnancy. And during a very stressful event, the body secretes the hormone called cortisol, which is the stress hormone. And the research has revealed that the higher cortisol level released in the mother's body during the pregnancy due to stressful events alters the function of hypothalamic pituitary axis, HPA, in the fetal brain. Also, the baby's brain, the HPA function is altered, which eventually leads to cognitive as well as development issues. And the other factors that determine this alteration of HPA axis are, such as intensity as well as the duration of stress and the period whatever was the duration of stress impacts the baby's health and mental health as well as physiological health in that manner. So exposure to prenatal stress by the mother also increase the child's fear and fearful tendencies. Now, coming on to management of mental health. So with advancement in science, there are various treatments that have become available to address mental health problems during pregnancy. So if they are in adverse cases, women can intake certain psychiatric medicines, and but the intake of and discontinuation of psychiatric medicines are recommended only after consultation with the physician. So it's only because certain medicines are not suitable during pregnancy, psychiatric medicines. So whether they should take it or not take it, it's usually dependent on the recommendation of the psychiatrist. And this must be really followed up with from time to time by the mental health practitioners. If the woman has such severe condition in mental health, then she might need to visit the doctor or the psychiatrist a couple of times and strictly follow certain routine, and also might require the major classes of antipsychotic medication, which are antidepressants or sometimes selective serotonin inhibitors, which increases the production of serotonin, the calming hormone in the brain. So, but all this can only be suggested by the advice of the psychiatrist. And so these are kind of dose-sensitive medication that are highly vulnerable to side effects. So these drugs are also habit-forming. So one can form habit of these. So therefore, the treatment has to be really performed under the careful supervision of the medical practitioner. And the risk and the benefits of psychotropic medication in pregnancy has to be considered quite well by the couple or the women. And the general belief regarding psychotropic drugs is that they should not be consumed during pregnancy, and they can cross the placenta and also expose the baby with the medicines. So, however, there are risks associated with prenatal exposure, and it can be, congenital malformation or cleft lips in the babies, where half of lip is kind of partially missing, and it can also lead to neonatal toxicity and affect the neurological behavior development of the baby. And when exposed to these kind of substances, even after 32 days of gestation, that means 32 days of pregnancy, the subtle changes in the behavior and functioning of the baby can emerge, and also later in the child's life they can be observed. So irrespective of this evidence, no major adverse events has been reported in infants due to these drugs, but the risk of not treating mental health issues was higher at times than the risk of exposure to these medications to the baby. So to reach a very definitive conclusion, more research would be needed in this area by the scientific community. So hence it's really recommended to follow, healthcare professionals or the psychiatrist to suggest what are required in the moment. Now looking at the antidepressant. So exposure to antidepressants during the first trimester can increase the risk of birth defect for the baby, and the common symptoms observed in exposed infants are tremors and restlessness and also frequent crying. However, no major congenital malformations have been reported with the exposure of antidepressant drugs in the babies. Although there have been more scientific observation that might be needed here in order to ensure the complete safety of the mother and baby, but still these are kind of acceptable drugs during the pregnancy. There are also anti-anxiety drugs like benzodiazepines, and they are the drugs of most common choice for the anxiety. And exposure to these drugs during pregnancy slightly increases the risk of cleft lid formation for the baby. And also, these drugs are associated with prenatal syndrome and poor muscle tone. So there is less data actually available to check the safety of these drugs during pregnancy. Generally, anti-anxiety drugs are not recommended for the pregnant mothers, but really depends on what the doctors or the psychiatrist takes the call. Now, when we come to psychiatric medications and breastfeeding, when there is a case of postpartum depression, a large number of women may have to take psychiatric medications during the perinatal period. And these medications enter the child's bloodstream through the breast milk. However, there are no adverse events that are, common among infants with the exposure of the psychiatric medications. Yet, this really depends on the type of medication, the amount of dosage, and the frequency of dosing, and so on. Now, the next common therapy for the management of depression during and after pregnancy is psychotherapy. So, expressing a concern to a third person can really help address the mental challenges to a greater extent. And this can help deal with their mother's depression, stress, and anxiety. So usually mental health treatment really begins with counseling session, and if required, then they move on to other therapies. So cognitive behavioral therapy is also common therapy which is widely used for the treatment of mental health, any kind of depression or other mental health issues. And this approach focuses on identifying and changing the negative thought patterns and behaviors. So it aims to help the mothers to develop healthier coping strategy for managing various challenges, and that includes their common mental health issues like depression, anxiety, and PTSD. So the CBT, cognitive behavioral therapy, in CBT, the therapists work collaboratively with the clients to challenge and reframe the irrational beliefs and perception, thereby promoting more positive and adaptive ways of thinking and behaving. And through structured sessions and practical exercises, mothers can learn to recognize and modify unhelpful thought patterns, leading to improvement in mood, behavior, and overall well-being. And CBT is actually a very evidence-based therapy, and it has been shown to have quite effective results in treating wide range of psychological disorder, and hence it makes a quite valuable tool in mental health treatment. Now, there are alternative therapies also, and first would be acupuncture, which is an alternative therapy that can aid to mental health treatment. In acupuncture, the treatment happens with needles, and needles are pierced in different parts of the body to ensure balanced energy flow. Now, mindfulness and yoga practice is also another great benefit alternative therapy that works wonders at times for the mental health of the mothers. So, yoga and meditation are already well-established method that helps prevent and also treat physical and mental problems. And yoga practices ensures the mental well-being in many ways, and it also helps regulate hormonal balances, hormonal levels, and which are usually a primary cause of mental health issues during pregnancy. Also, it removes the energy blocks and thus it ensures a blood flow to all parts of the body, and that contributes to better mental health. And as the blood flow increases, it also ensures the proper nutrition to the baby, which is again an additional benefit of yoga. And yoga asanas and pranayamas and meditation practices are quite most comprehensive ways to address the issues of different kind of human issues and different aspects of human mental health as well as physical health issues. So when it comes to mental health, it has to be approached from various angles, and yoga and meditation and can just be also used as complementary therapy at times, along with the psychiatric treatment, or even sometimes when women are taking psychiatric drugs, even then it can act as a complementary medicine. So thereby what is important here, that mothers actually understand the importance of their mental health, and they understand the kind of risk that is involved during the pregnancy with their mental health. So therefore, really educating the mothers as well as their partners on the mental health issues during the pregnancy becomes quite important. And here, a healthy lifestyle is also a very important part of the pregnancy. The more healthier they are, the lesser chances of becoming mentally ill. So education about mental health can really help to follow a healthy lifestyle which is suitable during pregnancy, and also synthesize their partners towards creating a better opportunities for the mothers to opt for self-care and therapies and whatever is required, and ensuring that the partners are providing, just because then this is only possible when they are well aware. So awareness on the mental health problems during pregnancy can really also help overcome social stigmas and sometimes unscientific cultural issues also. And it can also reduce the burden of expectation on mothers and provide much space for them to express their negative emotion. When we choose to even educate their partners or their loved ones, close ones, family members, and the communities around them together, we can really help address these mental health problems in a better manner, especially for the pregnant women and also in the postpartum phase. So there has been a lot of governmental policies in many countries these days that favor the mental health of the pregnant women, also during both in prenatal and perinatal phase. And so the prevalence of mental health problems in the developed countries is comparatively lower than in the developing countries. So creating a supportive health services and the community can really reduce anxiety among the pregnant women, especially with the poor socioeconomical backgrounds. And so what we need to remember is that not only pregnancy is not only about good emotions, but it's really about biological, psychological processes that can also go wrong at times. So mental health can be disturbed not just due to purely emotional reason, but due to imbalances in the body or in the brain, physically also at times. So with that, I really hope that this was helpful and this supported your understanding on the mental health for the pregnant women, and you continue to support the mothers through various means and resources that you have been gaining so far, and this also becomes one of the great tools for you to make the mothers aware of their mental health and support them in this journey. With that, thank you and namaste.